Hello and welcome. On behalf of the Saskatoon Industry-Education Council, we would like to welcome you to our Career Pathways panel. We'd like to acknowledge we are on Treaty 6 territory and homeland of the Métis. We welcome students, parents, and teachers from across the province who are joining us today. For the past 2 decades, the Saskatoon Industry-Education Council has bridged the gap between Saskatchewan school systems and employers, providing experiential learning and career development opportunities for Saskatoon and area youth. As a registered nonprofit organization, the Saskatoon Industry-Education Council works in partnership with the 3 school divisions and the Saskatoon Tribal Council, as well as community-based organizations, government agencies, and employers to help nurture the workforce of tomorrow. Last year, the SIEC worked with over 29,000 youth, 1,300 businesses and post-secondary representatives, and more than 600 educators and career practitioners. Every year, we host over 40 programs and events, which include our skills boot camps, where we provide students with hands-on experience in various careers. Spotlight on Careers are events such as this, where we give students an insight into various career paths. Connected, a women mentorship program connecting high school females with mentors from a wide variety of sectors in Saskatoon. And the Summer Youth Internship Program, which is a 6-week paid internship where students gain work experience in construction, manufacturing, automotive, culinary, and the IT industries. And the students can earn competitive wages as well as high school credits. We encourage you to visit our website and follow us on our socials to stay up to date with our program offerings. At the SIEC, we feel it's just as important to find out what you do not want to do as it is to discover what you do want to do as a career. So if you're not sure what you want to do after high school, we highly recommend you attend a few of our events to discover the various career options available for you. We want to encourage everyone participating tonight to utilize the Q&A function and ask any questions you may have. Your questions may be for a particular speaker, or you may have questions in general about the profession. So please utilize the Q&A function, and we will try to get any questions answered either throughout our event or at the end when we have time set aside for Q&A. So we're going to get started with our event. So first off tonight, we are going to hear from the Saskatchewan Health Authority. So we are very fortunate to partner with the Saskatchewan Health Authority for events such as this. And tonight we have Thomas Skalski joining us to talk about his career, or about careers in healthcare. So Thomas is an associate with the Workforce Planning and Employment Department at the Saskatchewan Health Authority. He's been with the SHA for over 2 years and primarily focuses on recruitment for Saskatoon and the surrounding area. Thomas attended the University of Saskatchewan, where he obtained his Bachelor's of Commerce degree with a major in human resources. So please welcome Thomas.
Thank you, Michelle, and good evening, everyone. Welcome to the 2020 Occupational and Physical Therapy panel. One of my roles within workforce planning and employment with the Saskatchewan Health Authority is to assist in the recruitment of future healthcare workers. We are always eager to share information about the occupations in healthcare. Our hope is that the panel today will help you make an informed decision about your future career path. I'd like to thank our panel of presenters for taking the time tonight to share information about their careers and experiences in occupational and physical therapy with you. Before we start with our first presenter on the panel, I'd like to give you a bit more information on the Saskatchewan Health Authority, also known as the SHA. The SHA employs approximately 44,000 employees across the province of Saskatchewan in a wide range of occupations. The goal of our organization and our workers is to provide high-quality healthcare to the people of Saskatchewan. It is very important that we have strong interprofessional teams that work together in order to achieve our vision of healthy people and a healthy Saskatchewan. Within our care teams, we have occupational and physical therapists that provide care to patients in the form of rehabilitation services. An occupational therapist's role is to treat injured, ill, or disabled patients through the therapeutic use of everyday activities. They assist patients in developing, recovering, improving, as well as maintaining the skills needed for daily living and working. A physical therapist's role is to provide services that help restore function, improve mobility, relieve pain, and prevent or limit permanent physical disabilities in patients with injury or disease. They restore, maintain, and promote overall fitness and health. The starting wage for occupational therapists in the Health Authority is $34.49 an hour. The starting wage for physical therapists is $35.94 an hour. The SHA is a unionized work environment. This means that our workplace rules and policies are governed by collective agreements that were negotiated between the union and the SHA. OTs and PTs are part of a union known as the Health Sciences Association of Saskatchewan, or HSAS for short. The basis for the HSAS union is seniority. Seniority drives our selection process for employment and hours to be picked up for work. Having the union in place also standardizes wages and benefits across the whole Health Authority. The work environment at the Health Authority is constantly changing and evolving, whether that be opening new facilities like the Jim Pattinson's Children's Hospital or dealing with a global pandemic. The constant change also means that there's constant demand for employees, which translates to excellent job security and competitive wages and benefits. There are also many different career paths and opportunities within healthcare for physical therapy and occupational therapy, which our panel will go over tonight. Thank you.
All right, thank you, Thomas, for bringing greetings from the Saskatchewan Health Authority and for sharing that information with us. We'd now like to welcome our panelists joining us tonight. So first off, we are going to hear from Joanne Nelson. Joanne is a licensed practicing physical therapist with 35 plus years of clinical experience in a wide variety of specialties and locations. She received her Master's of Science in 2016 from the School of Rehabilitation Science with the College of Medicine in Saskatoon. She presently holds the role of professional practice lead for physical therapy in the Saskatchewan Health Authority. So please welcome Joanne.
Hi, thank you for asking me to present tonight. I am going to give you an overview of physical therapy and occupational therapy as professions. And I'll just give you kind of some of the highlights about the professions, and you'll look forward to hearing from the clinicians as they are able to speak a little bit later. You're someone who enjoys working with and helping people, would like to help others to be independent as possible, enjoys science and physical activity, feels that doing things is a vital part of health, enjoys working together with a team, and really enjoys using creative problem solving, well, then you've come to the right presentation tonight. So you'll look forward to hearing about physio and occupational therapy. You often hear the terms PT and OT, and those are just the abbreviations for physical therapy or occupational therapy. And rehabilitation is really the realm of what physios and occupational therapists do. So I thought I'd just present the definition. And rehabilitation means the process of helping a person who has suffered an illness or injury to restore lost skills, so regain their maximum self-sufficiency. For example, rehabilitation work after a stroke may help the patient walk, dress themselves, and also, speaking clearly. So all of those things fall into the realm of rehabilitation. Many things are similar with occupational therapy and physiotherapy. Both professions, you work with people of all ages, from babies right to the very old elderly population. Both professions help to minimize or prevent some of the physical problems that arise from injury, disease, aging, disability, birth defects, or long periods of inactivity. Many things are similar. as in the work settings as well. OTs and physios work in the hospital, in rehab centers, communities, schools, long-term care facilities, private clinics, and even in some industries and many different areas. So here you see physios working in the hospital, kids working on every type of physical disability. PTs and OTs also deal with assessing, treating, training individuals in order for them to regain maximum function. So education and teaching people about how their bodies function and how they can become better is a huge part of our career. The main goal for both physio and OT is to obtain and maintain an individual's highest independent function. And so talking to people and finding out what their goals are so that we can facilitate them to gain that independence after an injury. Both OTs and PTs can work independently, or many times within the healthcare system, they're part of the healthcare workers team. When you think of physical therapy, it is the 5th largest group of health professionals in Canada. We are primary care practitioners and we can work independently. We work in many settings, as I had said earlier, but this just gives you some examples. There's aquatherapy, there is rehabilitation centers where you work with very many different people for many different aspects to improve strength, range of motion, and getting people to be as independently as possible. A lot of times in kids therapy, you can work with horses. They have found that, having kids ride horses, your trunk control is challenged, and so you become much stronger, therefore improving your balance even when then you start with your walking. And in children's rehab centers as well, assessing children, getting them progressing through their development and gaining strength, balance, and range of motion as they need. Also returning to work programs, orthopedic injuries such as post-surgery, after sports injuries, many different areas, anything to do with sort of muscle, bones, and strength, physiotherapists would be involved. And also in neurological conditions, such as people that are in wheelchairs or have strokes, women's health. And another area that some people don't even realize that physios are very involved in is in the cardiorespiratory system and assessing lung health or rehabilitation programs following heart attacks or diagnosis with a chronic condition. Physios can be involved in the exercise programs to get people stronger and functioning to their greatest ability. This is just opening the door for you to understand a little bit more about the physiotherapy profession. So I'd like to present a couple of websites, the Canadian Physiotherapy Association site and the Saskatchewan Physiotherapy Association site, where you can learn much more in detail about the physiotherapy career. And what is the highlights of occupational therapy? Well, it's the skills for the job of living. And as a profession, activities and tasks of everyday life. So your self-care, bathing, dressing, cooking, all those things can be impacted if you have a major injury. Well, the occupational therapist can help you navigate through those skills and find ways of performing them if you have had a major injury of some sort. Looks at your leisure, your hobby, sports, socializing, and your productivity in your work, your school, and play. With occupational therapy, we all have many occupations that are essential to our health and well-being. Occupational therapists believe that the occupations describe who you are and how you feel about yourself. And some examples is children play and go to school. So those kind of activities are hugely important to the child. So the occupational therapist would assess those skills and facilitate the best way that that child can engage in those play activities and adapt how they can go to school if there is some limitation in some way. And an adult may work, take care of the household, drive, take care of finances. So all those have an impact on their well-being, and the occupational therapist would have skills to be able to assess and assist in all of those areas. One of the occupational therapy sayings is medicine gives days to your life, but OT gives life 2 days. So you can enjoy yourself more because you can do it in a better way, all the things that you enjoy. Sort of practice specializations in occupational therapy. A great list here that we've already talked about, but just highlighting like driving and even depression, anxiety, and ADHD, work assessments, skills in every different area of functional capacity, and even ergonomics, which is your workspace. And both physio and OT can help a lot in that realm. And here as well, I have listed some occupational therapy resources, which can give you many more resources to understand the profession a little bit better. And the YouTube that I placed here is an excellent one to give an overview of the wide berth that occupational therapy has in their scope of practice. And just to end my presentation, I had a colleague that retired after 30 plus years of work within the Saskatoon Health Authority. And she said that she was just so happy that she had chosen the career of physiotherapy because she felt that she had a positive impact on people in her caseload that she saw every day on an everyday basis. She said the profession, she has never been sad that she chose the physiotherapy profession because she had that impact positively every day on people that she saw in her career. So I just want to leave you with that because it really does show that the rehabilitation careers are just a, if you're interested in them, they can create a great satisfaction for you as a career. So I'm going to pass it on now.
Thank you so much, Joanne, for being with us this evening and sharing your experience as a physical therapist, and as well as giving a great overview of what a day in the life looks like for an OT and a PT. We have a lot of students I know from our past events looking at these career paths. A lot of times students don't understand the difference between the two, or they may have them confused as which role does what duties when working with patients. So thank you so much for being with us tonight, and I'm sure we'll have lots of questions at the end. Once again, if you do have questions throughout, then please put them in the Q&A function. So we are going to move on to our next panelist this evening, who is Anessa Van Dusen. Anessa graduated from the U of S in 1990 with a Bachelor of Science in Anatomy, and in 1993 with a Bachelor of Science in Physical Therapy. Since graduation, she's worked with the public sector for 27 years. Anessa has worked in a number of different areas in Royal University Hospital. She did a short stint at rehab at Saskatoon City Hospital and is now the Senior Pediatric Physical Therapist at the Jim Pattison Children's Hospital. Over the years, she has specialized in the areas of neurology, neurosurgery, and pediatric physical therapy. She has spent time treating patients in both the inpatient and outpatient sectors, and she is also a lab assistant with the School of Rehabilitation Sciences at the University of Saskatchewan. Anessa has participated in research as well as clinical care and program development over the years. So please welcome Anessa.
Hello. I hope you can hear me here. So thank you very much, Michelle, for both the introduction and the invitation to be here. And good evening to everyone. As Michelle shared with you, my name is Anessa Van Dusen, and I've been a physical therapist working in the public system. So in the hospital system for now, it's almost 28 years. In May, it'll be 28 years. And to this day, I continue to love my job. Looking back to my university days, and when I first applied and interviewed for admission to the then School of Physical Therapy, I am so glad I persevered and didn't give up after being unsuccessful on that first attempt. I was admitted after my second application to the school and haven't looked back since. So as a physical therapist, I assess my patients to determine what physical impairments due to injury or disease are limiting their ability to move, to achieve their goals, or to participate in daily life. I then come up with a treatment plan and provide treatment with goals of helping them to regain their strength, their range of movement, improving balance, maximizing their functional abilities. And by that, their functional abilities could be just moving in bed, getting out of bed, being able to move from a chair to from the bed to a chair or back again, getting into standing and walking. And I'm sure you've seen someone wandering around out when you're shopping or something using a walker. Often we are the ones that are helping these people get going again and helping them use the aids appropriately. So again, a lot of things Michelle said is true about me. I've worked within the Saskatchewan Health Authority for my entire career, though it's had a bunch of different names. And in that time, I've worked both part-time while my children were young and now full-time. The majority of my career, I worked with inpatients at the Royal University Hospital. So these patients having suffered neurological illnesses or diseases or accidents. I worked a lot with people who had strokes, brain injuries, spinal cord injuries, brain tumors, multiple sclerosis, Parkinson's disease. I also have spent time working with those with the cardiorespiratory conditions that Joanne alluded to, people who need help with pneumonia or cystic fibrosis or COPD, otherwise known as chronic obstructive pulmonary disease. I've worked with people with orthopedic injuries, such as fractured ankles, polytrauma, joint replacements. And I have worked in both in and outpatients. Here in the hospital, we work very closely, often as a team, with other healthcare professionals. These people would include our doctors, our nurses, occupational therapists, I work very closely with them, speech language pathologists, dietitians, pharmacists, medical social workers, etc. Now, as it is never too late to learn something new, just over 2 years ago, I moved into the senior pediatric physical therapist position at the new Jim Pattison Children's Hospital. Here, I work with pediatric patients primarily from birth all the way up to 18 years of age. I have worked both inpatients and outpatients in this pediatric population. In my senior role, I also support 7 staff therapists. And I also have mentioned in my bio that I have had the opportunity to participate in research as a physical therapist. As well, I am assisting in the labs at the School of Rehabilitation Sciences at the University of Saskatchewan as a teaching assistant. When I think back over my career, some words that stand out for me are interesting, challenging, and I mean in a good way, rewarding, very, variety, and opportunity, with variety being explained by the many different types of clients, ages of clients, and settings that we can work in. Opportunities. I had the opportunity to work part-time or full-time. I've been able to take on new roles, do the senior position. I've been able to move from adults after many, many years to pediatrics, and I absolutely love the change. And I also have been able to participate in research and help teach future physical therapists. So this is a terrific career for many reasons, in my opinion, but the most fulfilling part of physical therapy as a career is helping people. Thank you.
All right, well, thank you so much for sharing your extensive experience with us. You've worked in many different areas, and I think that that can give a really great overview to the variety that there is in physical therapy. So once again, if you have questions throughout the night, make sure you put them in the Q&A. Next up, we are going to hear from Laura Oberg. Laura has been a registered occupational therapist in Saskatchewan for all of 2 months, and she is grateful to have discovered this rewarding and fascinating career. She's originally from Victoria, BC, where she completed a Master's of Science in Occupational Therapy from the University of Alberta. She brings a background in music and psychology to her practice and is particularly interested in chronic disease management, mental health, neurological conditions, and supporting safe and positive aging in place for older adults. Lara is currently working in neuro rehab at Saskatoon City Hospital, where she assists in the recovery journeys of adults who have experienced stroke, spinal cord injury, and other nervous system injuries. She is the co-chair of the Staff Starters Network, a group dedicated to supporting new OTs in Saskatchewan, and is passionate about teaching and mentoring. So please welcome Laura.
Hi, everyone. I'm so happy to be here tonight. Thank you, Michelle, for the introduction, and Joanne for the lovely overview of occupational therapy at the beginning of this presentation. To all the students or parents here, I am so glad that you are here to learn more about these careers and that you're taking the time to explore, as Michelle said, what you're interested in and maybe what you aren't interested in. From my journey, I didn't know what occupational therapy was until quite a bit into my career in psychology. So I hope that this presentation, for at least some of you, will serve in some way as an earlier start than I had. Not that there's anything wrong with starting later. So what is occupational therapy? As I say, I wish I had known about it sooner. I went through a number of different career paths, and I found they didn't quite fit what I wanted to do and how I wanted to help people. Occupational therapy is, as Joanne described, a rehab profession where we look at self-care, leisure hobbies, and productivity. That's kind of the jargon of it. I also like to think about it as helping people to do what they need to do, what they want to do, and what they have to do. And we do that by getting a really thorough understanding of the person, any conditions, medical or mental health that they may have, and the environments where they need to do those things that they need to do, and kind of piecing it all together in a really creative problem-solving sort of a way to help people achieve their goals. I love that saying about how OT gives life to your days. I haven't heard that. So thank you for sharing. What OT or occupational therapy actually looks like can vary a lot depending on the setting where you work. And many of those were listed at the beginning of this presentation. I'd like to add just a few more, if I may, that I think are really interesting, almost niche areas for OT. We can work in palliative care, which is end-of-life care. So in that setting where we're not necessarily working at restoring function, but we're working with a person to maximize the quality of their days, with their interests, with being able to engage with the people that they want to do, with reducing pain in non-medical, non-pharmaceutical ways, providing education and support. I would say that depending on the setting where an occupational therapist works, there can be a lot of overlap between other professions. Anissa alluded to the overlap with physical therapy quite often in hospital settings. If you're working in a rural setting, you may do a lot with feeding and communication and technologies around someone who has had a life-changing accident happen, say a motor vehicle accident, and their life has changed and they can't speak easily. They are having trouble doing all these things that they used to do to make them feel like themselves. And you as the OT could be involved in so many different roles there: feeding, communication, positioning, wheelchairs and seating. And it's amazing what a good wheelchair and seating system can do for being able to make a person feel more in control of their life and in their environment and what they want to do. How to become an occupational therapist? You may know, if you're watching this presentation, that there is actually no OT program currently in Saskatchewan. So the nearest ones are Alberta and Manitoba. I went to the University of Alberta, and I chose that school particularly because of the neuro focus. I love seeing how the brain actually comes through and shines in the behaviors that we have and that we do, and understanding how we can harness those amazing strengths to support people's goals. So you would typically have a bachelor's degree. Kinesthesiology and psychology are common, but almost anything, as long as you have that anatomy background and some stats, unfortunately or fortunately. And then you complete a master's degree, you write an exam, you get some fieldwork experience, and you start working. And honestly, I'm just so thrilled to have found this profession. I could talk about it for like the entire time, and I'm watching the clock and trying to be more mindful of the fact that there are others coming up. But I wanted to add that if any of you have any interest in occupational therapy, even a question that may seem like a silly question, there are no silly questions. Occupational therapy, I think, is this beautiful career where you get to be people's cheerleader and life coach and just support them to really have that life that you want. I remember when I was younger thinking, well, what profession can I go into to help people to be their life coach? What kind of a degree can I have for that? And after a few trials, I found OT, and I'm so grateful. I've never looked back. So if you do have any questions or want to talk about occupational therapy, please feel free to reach out to Michelle, and she can pass on my contact information. I'd be more than happy to have a conversation with you. I think that's it for now. Looking at my notes. Thanks, everyone.
Oh, thank you so much, Laura, for being part of our event tonight. And you say you've only been an occupational therapist for 2 months, but your passion and your love for what you do is very evident in the way you speak about the career path that you chose. So thank you for sharing that. And thank you also for talking about why you chose the post-secondary that you did as well, because it's good for students, especially when they are having to branch out, and if there isn't programs offered locally, then you need to make sure that you are considering all options of those post-secondary that you are planning on attending. And that was a great insight into why you did choose where you went. So thank you. Next up, we are going to hear from Nicole Lopes. Nicole completed her undergraduate degree in athletic training and biology at Graceland University in Iowa, USA. And she completed her master's degree in physical therapy at the University of Saskatchewan in 2015. She has worked in a variety of fields, including public and private practice. Nicole has pursued further training in pelvic health, Pilates instruction, and Grafton technique soft tissue mobilization. She currently works on the convalescent unit at Saskatoon City Hospital with a mixed caseload of patients with varied medical conditions. So please welcome Nicole.
Hello, everybody. I hope you can hear me. So I'm actually really thrilled also that you guys are holding something such as this for a panel for students, because I remember being at that cross mount at almost basically grade 10, where you feel like you have to have made a decision almost of where you're going and what your program is. And it's a really daunting time. So I appreciate the idea to at least have opportunity to learn of more available fields. So my background, as you can tell, is quite unique, I guess. I originally had thought, okay, well, I really like physics. I love biology, anatomy. And so I thought, okay, maybe a career in sports and human science and movement. So I ended up thinking I wanted to be the athletic trainer for the Rough Riders. Being from Saskatchewan, that was my end goal dream. I decided, well, there was no athletic training program in Canada, or well, in Saskatchewan at that point. So I ended up going to school in the States. But my end goal was always to come back to Saskatchewan because we have physical therapy here. So that's what I knew early on as my goal. And I think that's kind of privileged to have chosen something so early, because I know it's a daunting task and not necessarily where everybody is. So if that's not where you're at, don't worry and keep looking, it's fine. But as far as physical therapy goes, I really liked like I said, the movement of science. I ended up working a number of years once I finished physical therapy in the private world. So working with sports as a first responder, an athletic trainer, physical therapist, doing sideline medical coverage and things. And I really enjoyed the musculoskeletal part. So muscles and bones and sports injuries, work injuries, motor vehicle accident injuries as well, which is another part of populations that we do see in the health region as well, or in the health authority. And I ended up also having a little bout with research as well along with that. I agreed to participate in a study as an assessor for rural individuals in Saskatchewan regarding falls and fall prevention methods, as well as access to rural resources when it came to physical therapy. Because being from Saskatchewan, that's another piece that we struggle with, or we have something that's unique, is reaching those populations in further areas around the province. So it's still not a foolproof method that we have achieved yet, but it's very, oh, I'm just looking at the questions here. Maybe we'll come to that at the end. So the rural aspect is a very unique piece as well, and very integrated in physical therapy as well as occupational therapy. And so I ended up moving over to the public sector, working on that once I really enjoyed working with some of those aspects of the research. So working in the Saskatchewan Health Authority, I did work in community therapies in the city of Saskatoon. So that's another thing, working within people's homes and going out and reaching people where they are. And that's another piece that is so unique in having, yes, variety, as Anessa talked about, but also varied work environment, which I really liked. So it's not necessarily the desk job scenario, it's working with your hands, working with people, working in different environments. And so I really found that interesting as well. There is quite a bit of a learning curve as a professional when you are starting out, because we do have lots of clinical placements in school where you end up having lots of hand-on experience or first-hand experience, but being able to work as a professional, that was a struggle at first. But the best part about it is, as people have mentioned, we do work closely in a team. So whenever there are struggles, and sometimes things don't go as according to plan, and you have to be able to problem solve. That was another piece that I really found passionate of what drove me towards physical therapy. So having that team aspect to treat people on the whole was really unique. So I really would agree with Anessa and the other aspects that have been touched about physical therapy, particularly that it's a variety and challenging. You're continually learning, so that's another thing, and working with people. So if those things appeal to you, I think, feel free to let us know and we'll get to some of these questions maybe at the end, I think. Okay.
Okay, well, thank you so much, Nicole, for joining us this evening and talking about your experience as a physical therapist. And you have a very unique educational background, which is nice to highlight as well for students because, like you said, once you hit high school, then people start asking, what do you want to do after high school? And a lot of students have no idea where to begin. And so that's why we are very hopeful that these events that we put on throughout the year can help students to explore the different career paths. And by getting to hear from professionals like all of you here tonight, it really gives them an insight into what that career could look like for them. So thank you so much. And yes, I see we have some questions coming in, and please be patient. We promise we will answer those once we get to the question portion of the evening. So we are going to hear from our last panelist tonight, Danielle Drury. She is currently in her second year of the Masters of Physical Therapy program at the University of Saskatchewan. She completed her Bachelor's of Science in Kinesiology from the U of S in 2019 and promptly began her Master's of Physical Therapy that same year. So please welcome Danielle, and after that we will get to our Q&A portion.
Thank you, Michelle, for the intro and inviting me tonight. So my name's Danielle. I'm currently a physical therapy student. We're currently on placement right now, so I'm having a great time learning what the previous physical therapists have been saying about all the different kinds of settings I can work in. But a little background about me. In high school, I was very, very involved with sports. And being very involved with sports, I had my fair share of injuries. So I became quite acquainted with some physical therapists in a private setting. And the more that they were helping me out recover, I could really see the benefit in seeing physical therapy with injuries. That's where I became to fall in love with the profession and knew that that's what I wanted to do. So when I began university, I started my degree in kinesiology, kind of with the focus of exercise and movement. I did take my CPT, so certification in personal training, because I really love to teach people how to move and motivate them to get active and lead a really healthy lifestyle. So that was always an interest of mine. Luckily, I was accepted to the physical therapy program and I've absolutely loved it. We've had a little bit of a setback. Our program's been extended a little bit due to COVID-19, but typically it's a 2-year and 6-week program, which is nice and short, but you do have to have a bachelor's degree before that. So overall, about 6 years of schooling, which may sound daunting as a high school student, but I promise you it's worth it. Throughout school, we actually, I think, get about 30 weeks of clinical placement. So that's a large portion of our education, which is nice. I have nothing but great things to say about the instructors that I've had. Everyone is very knowledgeable and welcoming, and it's a great community to learn in. But yeah, now we're in clinical placement. I'm just appreciating all the things that physical therapists can do, because my view of physical therapy has changed greatly from in high school knowing that, okay, well, they can help me with my sport injuries, to now realizing that we can help people in hospital. We can get them breathing better. We can get them moving better. We can just get them up walking with a gait aid, and it's just endless. So if you ever are considering physical therapy, I highly recommend.
All right, well, thank you, Danielle, for being part of our panel event tonight and giving the student perspective. So I do see we have some questions in the Q&A. So if our panelists want to rejoin the show, then we can tackle some of these, and maybe if someone wants to jump in, or if you want to point the finger at someone in particular who can answer one of these questions, then feel free. So we are going to go to the first question, which says, does it help to have a sports background to become a PT? So I want to try, there we go. I'll change it so everyone can see you now. So I think this question did come in when Nicole was talking. So maybe Nicole, would you like to tackle that question for us?
So I will start by saying, I think when a lot of people encounter physical therapy or think of physical therapy, they first think of the sports industry. So having, I won't say it's a misconstrued perception, but being within sports, you're certainly going to deal with physical therapy. Injuries are rampant in sports. Now, as far as whether or not having a background in sports is a good prerequisite for physical therapy, I would say it's not required, because physical therapy is so varied that if you have an interest in sports side of sports medicine, great. If you don't, that does not mean you cannot have a career in physical therapy, that is for sure. So if you happen to have an interest in sports medicine or a background in physics, biomechanics, movement studies, kinesiology, all those things, if that's a passion for you, then maybe physical therapy is also a field you'd enjoy. But is it a required background? No.
Awesome. Thank you for answering that question. Did anyone else have anything they'd like to add in response?
I just would like to add that I did not have a sports background whatsoever. My first degree was in anatomy, and I've done just fine. So though I am interested in sports and enjoy them, I did not need that background in order to excel in physical therapy.
Awesome. Well, thank you. I know that can be encouraging for students to hear, because especially if you don't have a background in sports, then you may worry that this isn't the career path for you, but you may have passions in other areas and skill sets that can still help you be successful. Next, we have, what are the physical demands of the profession on you?
I can offer a comment here, if that's helpful, that within the Saskatchewan Health Authority, all employees are required to take and to recertify periodically in training, where we learn how to properly move our bodies, properly move objects, handle patients. It's a huge part of our requirements of actually being an employee here. That said, I know I've heard over time, after many years of a career, it can take a toll on people's bodies. So I think that leads into another question, which I'll say for now in case other panelists have comments here, regarding self-care and how you look after yourself, your body, and your mind as you're practicing.
So I do see that you're making a connection, I think, with one of our further questions. And so maybe we want to tie the two together. There's a question that says, can the job be mentally demanding, and how do you focus on your own self-care? So this could be both mental and physical self-care. And I see Joanne has her microphone on, so maybe she wants to tackle this one for us.
Yeah, I just want to say that in the profession, like Laura was saying, there is a lot of good supports through the health authority to educate you on, especially body movement and protecting your body. But there's also a lot of supports for mental health as well. What I've found that when you are, in the physiotherapy profession, you have a lot of people that you're working with. You are a team, so that when you do get overwhelmed with a problem maybe that you haven't seen before, you have your colleagues, and there's lots of consultation. And what I found wonderful about physio is you're learning something new every day. And if you take that as a challenge and an opportunity, like Anessa said, then you embrace your profession. And so then you don't get overwhelmed, which could end up being in that, sort of that whole area of sort of mental health. And so self-care, yes, is important, but I think in that team approach, people are going to identify that maybe you are having some problems and help with that as well. So yeah, I'll let somebody else add their point of view too.
If I can make a further comment just about the mental health and self-care piece. So for me, I found in the OT program that I went through, and that's the only perspective I can speak from, I learned a lot of strategies for myself to manage my own mental as well as physical health much better. And I think, as Joanne stated, that team environment, both when you're working and honestly, I think in a professional program where the demands can be quite intense, you end up forming often really close connections with your peers and with your students, learning a lot from them and going through learning about the content of the field. I certainly feel like I've OT'd myself a few times to try to figure out how I can deal better with some of the stresses in my life, with the stresses of the job, so that I can bring my best self to the job.
Thank you so much for answering those questions for us. I think that it's very important to keep in mind in any profession. Our own physical and mental health are always things that we need to keep in check, and we need to know when to ask for help, and we need to know when to say no, that's not safe, and those are our rights as a worker. So thank you so much for sharing that. We have a few questions here about kind of getting into the profession. So one question is, what were the first few months of your career like? Were they overwhelming? And then we also have a question asking, what are the job prospects like? So maybe those two might kind of connect with one another. I don't know if Thomas can kind of talk about from SHA's perspective what the job outlook is like, and then if anyone wants to chime in about kind of what it was the first few months or the first few days were like.
No, for sure. I can lead off with that, Michelle. Again, when I'm talking about job prospects, I'm talking about from the point of view of the health authority when it comes to recruitment for occupational therapists and physical therapists. And both of those professions are on what we call our hard to recruit list, meaning that we tend to always have to look externally to fill vacancies we have, and sometimes have, again, difficulties finding qualified applicants to work those positions. Yes, I would say job prospects in that regard for the health authority, job prospects would be pretty good, especially if you'd want to go work in a more, let's say, rural community. There's always opportunities to go work rural, but also here in Saskatoon as well.
So would anyone like to touch on kind of the other aspect of that question, asking about what were the first few months of your career like, or even maybe your experience in looking for a position? Did you find it difficult to find a position in the field that you were interested, or in the location you were interested in? And how did it feel when you first got into that career path?
So maybe I'll have a few words too, because I've only recently been with the Saskatchewan Health Authority for 2 years. So I've been trying to make my way through the job markets as well as the career path afterwards. So my plan originally was always to go into healthcare because I figured there will always be jobs in healthcare in Saskatchewan. It's a valuable task, and it doesn't disappoint. There's always jobs available in healthcare. Healthcare is very important, as we now know, if you didn't before. So there's always going to be jobs, and physical therapy is so ingrained in, and occupational therapy, both are very ingrained in people's lives. So as long as there are people, there will always be jobs, basically. And then as far as the first few months of transitioning from being a student to being a professional, that's the part where I think it depends on the type of mentorship is one piece that people have identified as when you're looking for a new first-time job, the type of mentorship that can be provided to you, because the schools actually do a really good job of transitioning you along to ensure that you have the qualified skills so that you can become a licensed practitioner. You actually have to pass licensing exams and things as well. So you have to be ready, but then getting started, having a team around you helps, and having mentors that can guide you through. There are some longer hours at the beginning, and it is a little bit tiring with all of the learning and reviewing and things when you first get started. But honestly, I think that's not any much more than if you were to start out as a working professional in almost any career, to be honest. So.
But we had, what advice do you have for students in high school regarding the courses we should be taking, and what undergrad would be the best option to help with a better understanding in the OT-PT programs?
Well, I can speak to OT at least, which again, in my cohort that I went through, and I technically have just graduated this year, we had most of our students coming from either a kinesiology background or a psychology background. But within that I would say that accounted for about 2/3 of the background. We had a lot of diversity otherwise. We had a former nurse, a former teacher, a dietitian, someone with a background in music, really diverse. And I think that was quite a strength of the program, actually. For OT, as I'm sure with PT, although I don't know the specifics with PT, there will be certain courses that are still required regardless of what your undergrad degree is in. So typically that includes things like statistics, which I actually surprisingly enjoyed. I did not like math in high school. And I actually liked statistics. I think I had a great prof in my undergrad, which made a huge difference. But anyway, that's another story. Statistics and anatomy are going to be the basic ones. And I took my anatomy degree at the end of my psych degree, preparing for master's, and remember thinking, wow, I think everyone needs to take an anatomy course, because holy moly, how does more not go wrong with the body all the time? Bodies are amazing. Anyway, so a few specific prereq courses and some variety from the OT perspective.
I was just going to add to the physical therapy piece as well. You're right. The statistics, anatomy, and physiology, I believe, are still the core prerequisites for physical therapy as well. And again, most people come to physical therapy with a kinesiology degree from Saskatchewan, but at the same time, when I was in physical therapy school, we had teachers, we had psychologists, and we also had people with math degrees. We had lots of people with a variety of degrees. So, and 5 teachers, I think people who had previously been teachers also found a passion in physical therapy. So there's a variety of options. And I think in high school, it used to be that you also had to have at least, we used to call them physics 30-20, bio 20-30, those kind of things. So you used to have, I think, at least your grade 12 level of physics and biology. I'm not sure, but one of the biggest things is to try and make sure you have some of those fully rounded. I know they call them differently now, so I'm not quite sure if the terminology is still the same. You don't necessarily have to go through and do 100% of your maths and sciences just in case, but if there are any fields, it's worthwhile to look into which ones you need, but definitely having some of those further level courses just in case, because again, if you decide later on in life that you want to pursue some of these careers, it's a bit of a drag to have to go back to the high school courses and do it, but at the same time, not impossible. So.
All right, well, thank you so much, Laura and Nicole, for answering those questions for us. And I know we don't have anyone on from either of those post-secondary programs, but because they are both post-degree programs that you would enter into, I know especially when we talk to the College of Medicine, what they really encourage is that you focus your first degree on something that you're passionate about and something that really energizes you. And then a lot of times, even they said they would have people come with a music background or different arts backgrounds, and you can often tie that into that profession that you enter in later on in life. So there are always those prerequisites, and once you are in the post-secondary institution, then there's always representatives who can help you make sure that you have those prerequisites you need to apply to those post-degree programs. But a lot of times, yeah, it's taking something that is important to you and something that you're interested in learning more about. We're going to quickly wrap it up here. We have a couple of questions about the actual university portion of it. So the one question says, as a student, do you find the schooling overwhelming? And what does it take to be a great student in PT? Or is the program during university challenging, and what motivated you to keep going?
So I think I could probably answer a couple of those questions. As a student, the challenge for me was moving from high school to university, and then from my undergrad degree to the master's degree. Each time there was a little bit of a step up. You had more on your plate. There was a little bit more pressure I definitely found on myself, especially in my undergrad degree, because I was motivated not only to learn, but to get grades good enough to get into physical therapy school. But I felt that what kept me going was, especially in my undergraduate degree, was finding something I was passionate about and loved learning about, because that kept me wanting to study and engaged and interested. But in physical therapy school, yes, it can be overwhelming. Yes, it's a lot of work, but it's definitely rewarding. And you're surrounded by 39 other people that are going through the exact same thing you are. And you're really able to form this really awesome community and family with your classmates, because it is such a close bunch of students, each with the same goal in mind of becoming great physical therapists. So it's a lot of work, but I think it's definitely worth it.
Thank you, Danielle, for sharing your experience with us and answering that question. The last question of the evening, and then I promise we will wrap things up, is asking about the research portion of PT. So can you elaborate on the research of PT careers that someone had mentioned?
I did do some research. I was part of the team that was looking at actually it was remote learning of exercises for treatment of multiple sclerosis. I can't talk tonight. And so I was just a researcher that was part of a larger team that involved one of the physiatrists at the rehab center at City Hospital. So I just was a helper in that research. I did not set it up.
I'll also say that I think maybe Anessa and I were on the same project at one point. So I also was in that group, I think. But the other thing too, when I was working in private practice, I was part of a group that helped with individuals with muscular sclerosis and working on Pilates and side treatments of massage as part of that. So the Pilates piece was an addition to my background, but some of the researchers and the people who developed the research project were physical therapists. So I became involved because I was a Pilates instructor, but it was physical therapists leading the team on that. There is a number of research that goes on with the University of Saskatchewan. And so as a working professional with Anessa and I, we sometimes are approached with opportunities on the side, usually, most of the time is just a one-off event of being an independent assessor, researcher, participant. There are, I'm sure, roles available in research. They do exist, but I haven't had one of those full-time opportunities yet, but they do exist.
Yeah. Yeah, and if I can just add to that as well, I think physiotherapy and occupational therapy now are trying to be professions that are evidence-based. And with that, we try and provide treatment options that we know are going to work. And if we know that those are going to work, there has to have been at some point some research around those specific interventions that indicated that they were appropriate for that specific treatment, whether it be, using a specific type of modality for reducing pain after an injury, or all of those different things. So I think there is research on a larger basis, and I think the school being in Saskatoon, you have more of an opportunity to be involved in research as a clinician, because as clinical questions come up as you're working in the physiotherapy profession, those can become research questions and then research projects, especially facilitated by the School of Rehab Science here. So I think there's getting to be more and more opportunities, as Nicole and Anessa have talked about. But there's qualitative research where you're talking about people's perceptions about the treatments they're having, as well as scientific research where you're doing your randomized control trials, where you have a control group and an experimental group and actually see the reaction to an intervention at a specific time. So yeah, research is becoming sort of part of each clinician's time, and as you get opportunity, as Nicole and Anessa have said. Yeah.
Well, thank you so much to our panelists this evening for sharing both your educational and career journeys with the students in attendance this evening and those who are watching after the fact. And thank you for answering the questions that they had. I know that's the bonus of being able to attend these events live, is to ask those questions. And so thank you, all of you, for answering those questions for us and for being part of our event. So we're just going to quickly wrap things up. So I have a few thank yous before everyone logs off. So if you bear with me for a couple of minutes. But first, I'd like to thank our partners in putting this event together. So as I mentioned, we partner with the Saskatchewan Health Authority for events such as this. And I want to thank in particular Thomas Skulski, Emily Wright, and Joanne Nelson, who were instrumental in making tonight happen. I'd also like to thank my colleagues who helped make this event happen this evening. They are also on here with us, and they are behind the scenes messaging me when my microphone is off. So thank you to my colleagues, always helping me out. And finally, thank you to everyone tuning in and taking part in our event this evening. We are happy you're able to be with us, and we hope that you learned something from the event. So we do want to encourage some feedback. So any students who viewed this program either live or the recording, we would love to hear from you. Let us know what you thought. Let us know what you learned or what we could do different in the future to better meet your needs. But we offer programs such as this throughout the year, and so we always want to be improving. So leave us some feedback, and we look forward to hearing from you. We want to also encourage you to map out your future while you are still in high school and get involved in some of our other career exploration events that we have going on. So we do have another event tomorrow looking at mental health and wellness, and we're going to do a spotlight on mental health and addictions. And this is during the day. So many students have class during the day, so they may not be able to attend, but we will have a recording on our website. But in this particular event that we're going to host, it's in partnership with the Saskatchewan Health Authority once again, and it talks about careers in mental health and addictions, but it also is going to be a session that's going to talk about strategies for students to promote their own positive mental health. As we've all found during these very difficult times, our mental health can be something that is struggling. And throughout the year, every month, we've been highlighting a different sector. So we have recordings on our website of our past sectors that we looked at. So we looked at science and technology in October. We looked at manufacturing and mining in November, other health-related careers in December. And then moving forward, we have some other sectors we're going to look at, such as business and finance next month. We're going to look at the skilled trades, as well as careers in information and communication technology. So please stay tuned to our upcoming events, and we hope to see you again. And we want to encourage you to stay connected with us. Follow us on our socials so that you can see the upcoming programs that we have going on, and also check out our website where you can always register for the different upcoming events. So thank you for being with us tonight, and we hope to see you at our future events.